MPRO began providing IDR services in the state of Michigan over 10 years ago for a solution for providers to have an independent option for IDR. Over the years, MPRO has obtained other state contracts to provide IDR services. And then when the new regulations came out for IIDR, MPRO received contracts with many other states.
For the IDR contract, we have Michigan, Illinois, Wisconsin, and West Virginia. For the IIDR contract, we have Michigan, Illinois, Wisconsin, Florida, Ohio, Kentucky, West Virginia, Mississippi, New Mexico, and Maryland.
Our independent review is accredited by URAC. URAC is an accreditation entity that is internationally and nationally recognized. We have been accredited since 2002, and it assures that we have appropriate policies and procedures and quality standards.
There are many key differences between IDR, informal dispute resolution, and independent informal dispute resolution. One of the main differences are the time frames. A facility receives an opportunity for IDR when they receive their 2567 or statement of deficiencies. The facility receives an opportunity for IIDR only if the citation is associated with civil money penalty, and they would receive that opportunity when they receive their letter from CMS. One of the other key differences is that with IIDR, the state agency has to notify the involved resident and/or resident representative and the state long-term care ombudsman. They are given an opportunity to comment to the independent reviewers about the case. So the state agency has to make them aware of what citation the facility is disputing and tell them where they can send their comments to. The review process that we use here at MPRO is basically the same for IDR and IIDR.
When reviewers receive the IDR case here at MPRO, an objective analysis is done, the statement of deficiencies is reviewed, the facility rebuttal is reviewed, as well as the supporting documentation that the facility provides. Once the information is reviewed, this information is compared to the federal regulation. To make a decision, the State Operations Manual is reviewed, which is available on the Survey and Certification website. The intent of the regulation is reviewed, as well as the guidance to surveyors to assist in the decision-making process. In addition to code interpretation, reviewers also review for scope and severity determinations. This is available either in the Appendix PP of the State Operations Manual or in Appendix P. In addition, a professional reference search is made and included in the review as appropriate.
With the CMS mandated expansion of the IIDR program, we realized the old application we had wasn't suitable to service new clients. So we redesigned the application from the ground up to be a state-of-the-art web-based application that was extremely flexible and agile.
With our new data application, it's pretty easy and pretty simple. It allows us to put in when we receive the case, when it's sent out to the reviewer, when it's due to the state.
And we've done everything to make it as green as possible to reduce paper, reduce mailings, which reduces cost not only for us, but also for our clients.
We can receive the cases a couple of different ways. We receive them through a mail, and that is directly from the providers, or we can receive them from the Secure File Exchange.
Secure File Exchange is an application that we developed in order to securely and electronically transmit documents between ourselves and our clients. During this transmission process, everything is encrypted and stored on a secure server behind a state-of-the-art firewall, and this is to ensure that we have no possibility of having a protected health information breach.
Our reviewers receive monthly trainings that is a requirement to continue to remain a reviewer with MPRO. The monthly trainings keep everyone up to date on changes in regulation and standards of practice. they are done electronically, so if a reviewer cannot be a part of a monthly training, they can review the training at a later time.